the entire model. So we'll just try to think about how clinical reasoning has come to be. At first, we have, as we discussed in the previous videos and previous parts, the ancient era where the dominant model was observation. The core question was, what patterns do I see? And the modern legacy from that is the clinical eye. Then we have Renaissance, which talked about mechanistic era, where we asked, how does this thing work, which helped us get to the physiological logic. Then we had the pathological era, where we were talking about the anatomy of stuff, that is, where is the lesion located, which helped us localize things. And then we have the Oslerian period, where we had integrative model, where we talked about what does this patient of it in the bedside reasoning. Then we have evidence-based medicine, which is the analytical part, which talks about how does this data say, what does this data say, which led to critical appraisal. Now we are in this part about cognition, that is kind of metacognition, where we are reflective about how do I think. We have metacognition. So how do we go about it? We have to start with the following things. Today's physician uses the following things, including clinical reasoning, pattern recognition, imaging, labs, physiological principles, decision rules, risk scores, and Bayesian thinking. I don't know how to pronounce that word. That's the problem, guys. When you read a lot and you don't talk about things to people, it happens. So you start with the following. First, you observe what is happening, then you analyze, then you predict, and then you act on this prediction, and then you reassess. So, but what is the Bayesian thinking? That is, you update your beliefs with new evidence. That is, you start with hypothesis, you gather evidence, and then once something happens, once you get a new evidence, you're like, okay, I change, I'm better now. The idea is basically, once you get evidence, you test whether it fits your understanding or not, and if it doesn't, you update your understanding, right? So what I want you to understand is that you as a person are the heir. You are the heirs to the centuries of cognitive refinement which happened in the past centuries, and you must own that lineage. It's a beautiful thing. So many people work for this, and now we take the mantle forwards and we walk with it.